Many of the deaths reported in 2003 were not from the heat. Air quality scientists reported that 21 to 38% of the total excess deaths in the United Kingdom claimed to be due to high temperatures were actually the result of high levels of pollutants, ozone, and PM10. P.H. Fisher determined that 33 to 50% of the deaths attributed to the same heat wave in the Netherlands were caused by the same two air pollutants. In the Czech Republic, J. Keisley and R. Huth found that a large portion of the mortality increase that is often attributed to heat waves is actually due to a harvesting effect, which can be estimated to account for about 50% of the total number of victims. In other words, as they put it, people who would have died in the short term, even in the absence of oppressive weather conditions, made up about half of the total number of deaths. The real killer in Europe is not heat, but cold. According to the UK Department of Health, average winter excess mortality in a normal year in the UK alone is approximately 35,000. There is strong scientific evidence that normal cold temperatures kill far more people than summer heat waves, even severe ones, almost everywhere in the world. And since the primary effect of global warming is expected to be an increase in the coldest winter temperatures, moderate global warming may actually save lives. Added CO2 in the atmosphere may actually benefit the world because more CO2 helps plants grow. Warmer winters could give farmers a longer harvest season. It might end the droughts in the Sahara Desert. More frequent and more intensive heat waves could result in more heat-related deaths. These conditions could also aggravate local air quality problems already afflicting more than 80 million Americans. Global warming is expected to increase the potential geographic range and virulence of tropical diseases as well. Malaria, yellow, and dengue fever are related to the absence of vaccines, pesticides, screens, and other health care measures, not to temperatures, tropical disease expert Dr. Paul Reiter points out. Wisconsin had malaria outbreaks in the 1800s. Yellow fever claimed 19,000 lives in Memphis in 1878. 2,000 people get dengue fever in one Mexican border town in 1995, while Texas reported only 7 cases.